All right, so now I'm going to touch on the symptoms of schizophrenia, which are generally divided into three categories, which include positive, negative, and cognitive symptoms. So we'll start off with positive, which are generally known as psychotic symptoms because the person has lost touch with their reality. Positive symptoms refer to mental experiences that are added on to one's experience. So these are generally include hallucinations or delusions. Hallucinations can cause a person to hear voices inside or outside of their head, or less commonly, see things that are not there. Delusions occur when someone believes ideas that are just not, they're just false. So they may think that people are reading their minds, or they may think that they can control other people's minds. So the touch, they have definitely lost touch with reality there. Negative symptoms do not refer to negative thinking. Rather, they reflect symptoms that indicate a reduction of a capacity, such as motivation in life. Negative symptoms often include emotional flatness or lack of expressiveness. Um, Negative symptoms usually they can be an inability to start or follow through with activities. Speech is brief and lacks content, and just generally, there's no interest or pleasure in one's life. Difficulty with social cues and relationships are definitely common. These symptoms challenge rehabilitation efforts as work and school goals require motivation and social function. So it's definitely hard. Cognitive symptoms are pertaining to one's thinking process. Um, People living with schizophrenia often struggle with executive functioning, so prioritizing tasks, memory, and organizing thoughts. Cognitive function is involved in many tasks of our daily living, especially in work and school settings. A common cognitive deficit associated with schizophrenia is a lack of insight. So, someone is just not aware of having an illness. The difficulty in understanding is based in the brain. It is not a choice or psychological denial, and can make treating or working with people who live with schizophrenia much more challenging.